Hello, we're in respiratory part 9 of 10. Yay, we're almost finished. This one's going to be brief because you should already know about pneumonia. Pneumonia is an infection that involves the tissue of the lungs itself. It's associated with consolidation of fluids within the alveoli. Risk factors in children include malformations of the respiratory system, altered systemic or local immunity, and exposure to cigarette smoke. So I think this is about the 5th thing that increases the risk of a child getting sick due to exposure to cigarette smoke. And the cause of pneumonia will depend on the child's age, their immune status, do they already have some type of a chronic lung condition, who have they been exposed to, what have they been exposed to, and is it a nosocomial or community-acquired infection. So nosocomial means hospital-acquired. As you can see on the assessment, very similar to just about everything else we've talked about thus far. On your lung auscultation, you're going to hear rhonchi and crackles. There may be some activity intolerance due to hypoxia. So you want to look at the child's O2 sat. Diagnostically, your child should have had a chest x-ray. We'll look at the CBC to determine whether or not this is bacterial versus viral. Depending on how ill the child is, we will be collecting blood cultures, and this will be your job. You collect the blood cultures, the physician doesn't do it. And then usually respiratory is pretty good at getting those sputum cultures, but if not, that's going to be your job as well. When a child comes into an urgent care, an ER, or an office, the decision is made whether or not this kid can be treated as an inpatient or an outpatient. The more vulnerable children are going to be at admission. And don't forget the special needs children. The children who are developmentally delayed and who are not mobile, they have a very high incidence of pneumonia, and we almost always will admit them. And the reason we admit them is to administer antibiotics IV. Typically, we're giving some form of a penicillin or a cephalosporin, but this is based on the microbes within the community. So our infectious disease partners will let us know the best antibiotic to use based on the patterns within a community. You want to position this child with the head of the bed elevated. Their activity is going to be limited to the bedside until their activity tolerance is increased. At home, they need to curtail their activities for up to 1 to 2 weeks. They can go to school when they're feeling better, but they shouldn't participate in a lot of vigorous activity. For those who are admitted, we will administer oxygen as needed. They may or may not need a cool mist tent, and then we provide a lot of fluids. So this is very similar to our adults with pneumonia, and this ends the lecture on pneumonia.